Hey guys, this is Manu, Kalia, physical therapist and Ayurveda herbalist. So today's video is a little bit different. It's not an exercise or mobilization technique that I'm showing you. I wanted to go over something really important, and that's a major misunderstanding and regarding tendon injuries. So the common term that most people know about repetitive tendon injuries, repetitive strain type injuries to the tendons is tendinitis. So the term tendonitis, which is more popular, and I know even in some of my old videos, for example, when I'm talking about patellar tendonitis or Achilles tendonitis, I have mentioned the word, or I've said the word tendinitis. But that's just so it's easier for most people to understand, because most people are familiar with that term. But the correct term is actually for those type of injuries is tendinosis. So tendinitis, though it's used more commonly, is incorrect, okay? And the reason is because for repetitive strain injuries like patellar tendon issues for runners or athletes, or quadricep tendon issues of volleyball players, or in people who are doing a lot of activities that require jumping, or Achilles tendonitis type problems. And a lot of studies have seen this. When they really looked at it, they've seen there's no actual inflammation going on at that tendon. Okay, and remember, and I've mentioned this in my old videos, acute inflammation that takes place after an initial injury is a normal response of the body. It's not a bad thing. Okay, it needs to happen for the tissue to heal properly. Okay, so first of all, regarding the tendon, right, there is no inflammation, and they found that there are no inflammatory cells present in these injuries, and a lot of these are very chronic problems. Okay, so remember, anything that has itis at the end of it means inflammation, okay? And now when we look at tendinosis, which is actually the correct term for those type of problems, okay, which are caused more due to repetitive strain. Yeah, you can have a quick movement or an injury where there is a forceful movement taking or load going through that tendon, which causes micro tears or ruptures or even a partial or complete tear. That's something different, okay? And in initial stages, you might have an inflammatory process that takes place. But for chronic problems that come on over time, the correct term is tendinosis. Okay? Anything that has osis at the end of it is degeneration, okay? Which means there is due to excessive wear and tear. The body basically just can't keep up with the repair process. And so the load that's being placed on it, stress that's being placed on that tendon, is just can't keep up and heal that tendon. All right? So that's a major distinction between this problem. And that goes for all sorts of repetitive strain tendon type injuries. And that's why use of anti-inflammatories or, in my view, ice and all those things is not helpful for these injuries. It's not going to take care of that problem. Okay? So the normal tissue, tendons are, remember, made up of collagen. Okay? Collagen is protein. And in normal tissue, normal alignment of the collagen and tissue is in a parallel fashion. They're parallel bundles that are laid out, which give the tendon its tensile strength. Okay, so in normal fashion, they're laid out in an organized fashion. Okay, but once you start having these degenerative problems or degeneration of and wear and tear of that tendon, and when, like we said, there are no inflammatory cells present in tendon type injuries. Tendinosis or tendinopathy is another term that's used for that. Okay, so the collagen fibers are laid out in a disorganized manner. Okay, they're not laid out in parallel bundles. They're kind of jumbled and haphazardly laid out. So the normal healing process didn't take place properly. Okay, as the collagen was being laid down, as repair was taking place, it kind of went off, and it gets laid down in a jumbled, disorganized fashion, so that doesn't give it its proper tensile strength to that tendon. Okay, so you will see things like weakness, and you'll see things like swelling. You'll see thickening of that tendon just because things are not organized and laid down properly. They don't move properly. Okay, a lot of the studies have shown there's more vascularity, so there's more blood vessels that are formed, but again, they're formed in a haphazard manner, not laid down properly again. So they're not necessarily helping the tendon in terms of the healing process. So as I said, the cross-linking that's taking place, which is that jumble formation, the increased vascularity, and there's even more ground substance, which is this substance that's surrounding the cells, which supports the cells. So all these things kind of give it that thickened, swollen type of appearance to a lot of those tendons. So one, they're going to be thickened and swollen. They're going to be weak, okay, and of course you're going to have pain, and you might have some tightness along that tissue too. So think about it from this perspective when you're looking at treating these problems, okay? So as I said, it's not an inflammation type of problem. That's incorrect. So the understanding that most people have, ice it and take anti-inflammatories is going to take care of the problem. It's not going to take care of the problem, okay? So it's more of a degeneration that's going on, and so we need to do other things to get it better. So as in a lot of my other videos, you've seen cross-friction massage techniques that I've done, heat application, and internally you gotta do things to help the system heal too. And of course, backing off on the aggravating activity that's taking place. All right? So I hope it kind of gives you an understanding of what's going on, and we'll keep talking more about shooting videos on treatment options. And you've seen some of the treatments, and I'll go more in depth into some of the external factors and internal within the body factors that are taking place and causing these problems, why some people are more susceptible to those issues than others. All right. Also stay tuned. We got our program coming up pretty soon. Very excited, and it's going to be awesome. For those of you guys runners and athletes, you're going to love it. And we're in the process. We're building it up, and we're going to get the editing and those things done pretty soon, and it's going to be out. And if you have any questions, leave a comment, and make sure you subscribe to the channel, and click on the link below to check out the site. Thanks, guys.